Good evening, everybody. Today we are going to talk about whether if the child is having a blood cancer, is bone marrow transplant is required or not. Nowadays, I would say many of the parents and many of the children itself, like adolescent children, they read a lot about the disease which they are having or their child is having, and they come with a lot of questions. So initial diagnosis only, they ask me whether my child will require bone marrow transplant, whether the child is requiring the best therapy which is considered as CAR T cell therapy, or immunotherapy will help my child in the treatment, or whether it is required or available or not. So the answer is that, the simple answer is that not all children require bone marrow transplant, not all children require CAR T cell therapy, not all children require immunotherapy. So first of all, we need to understand what is leukemia, that is the blood cancer. In children, there are two types of blood cancers. One is the acute lymphoblastic leukemia and second is acute myeloid leukemia. Now coming to the acute lymphoblastic leukemia, it is a cancer which happens because of the white blood cells, and it is having a lymphoblastic lineage which is having a cancerous mutation. Now, considering that it is only one cell, but because of the different types of mutations, it is highly heterogeneous disease. It means the different types of white blood cells having a different kind of mutations are getting affected because of this leukemia. So whenever we make a diagnosis of leukemia nowadays, it is not enough to say whether it is lymphoblastic leukemia or myeloid leukemia. We need to do a complete panel of tests in which we need to know what mutation, what genetic mutation they are having, and what type of exactly this leukemia is. And from that, we are able to re-stratify the leukemia. So people, they ask me, this leukemia is at which stage? I would say that since our blood flows in each and every part of the body, we cannot re-stratify the blood cancer as stage 1, stage 2, stage 3 or stage 4. We need to re-stratify the blood depending upon the genetic mutations, and on that basis we are able to say whether the leukemia is a good risk, standard risk, intermediate risk, or a high risk or very high risk. So when we are talking about the good risk or intermediate risk, it means the chances of survival is almost 80 to 90%, and these children can be treated by conventional chemotherapy. So there are certain mutations like translocation 814 or other translocations are there which tells us these children are going to do better with conventional chemotherapy, and they don't require any higher treatment. When we talk about the high risk or very high risk leukemia, it means that they require higher chemotherapies, they require very aggressive treatment, and sometimes bone marrow transplant, CAR T cell or immunotherapy also. So this information, we can understand that all leukemias or all blood cancers, they don't require immunotherapy, CAR T cell or bone marrow transplant in the first go. We need to check many checkpoints. One is that what kind of leukemia is there, from the genetic mutations, from the age of the child, the type of presentation they had, and second thing is how they are responding to the chemotherapy. Sometimes the high-risk leukemia also, they respond very well to chemotherapy. So we don't require a bone marrow transplant. So again, your oncologist is the best person who can actually guide you whether your child will require bone marrow transplant or not, depending upon the type of the leukemia as well as response to the treatment. And with this, if there is any other further query, you can actually write to me on this email ID which is given below, and I will be more than happy to answer your query. Thank you very much.